It's starting 10 seconds.
Okay. Good evening, everyone. Am I audible and visible? Please confirm so I can start with the session. All the students, all those who have joined in, just say yes or no, and am I visible so we can start with the session. Good evening, everyone. Am I audible and visible? Please confirm so I can start with the session. Just waiting for your inputs and then we start. The team is just tweaking settings a bit. In the meanwhile, just type a hi in the comments so I would be able to know that I'm visible, I'm audible, and so I can start with the session. Okay, all is good. So, a very good evening to all the students who are attending the session, and some of you will be listening to this video after it goes as a recorded version on YouTube. First of all, myself, Dr. Pediatrics from Chandigarh, and I am into your professional teaching for specialty at PrepLadder. So the purpose of me coming over and taking this live session is manifold. First of all, I'll be talking about what are the new changes which have happened in the NEET super specialty pattern, the unofficial version of what you need to know, the areas you should be focusing upon. In addition, I'll be talking about how we are going to be. I'll also be talking about, and in the end, I'll have a small surprise also for you, a surprise announcement, some freebies for you or who are listening to this video. So first of all, let me just try to begin the session officially, and just a minute. Yeah, here we go. So as you can see on this, I've made some slides to give the broad headings, and I'll be talking about each one of them. So what are the things, the areas that you should be focusing on when it comes to pediatrics preparation in super specialty entrance exam? First of all, what are the changes that have happened regarding pediatric super specialty? What are the changes that have happened? There's some technical issue. Yeah, the changes have been taken through. So first of all, I'll be talking about what has changed in the pattern. So I'll be taking it up in the form of, the various things that you need to know. First of all, what are the changes in pattern that have happened in according to the latest prospectus? Now you need to understand that significant changes have happened when it comes to your adult medicine and adult surgery entrance exams, super specialty preparation related to pediatrics. There have been changes. They are not very prominent, but they are good enough for you to know, and you need to tweak your preparation accordingly. So first thing about the previous pattern. Before we understand and go towards what has changed, you need to understand how the paper earlier used to be. Till 2017, NEET super specialty was held in a very different pattern, which is very similar to what it has been made now. 2018 to 20, this was the pattern, and most of you who have prepared or given the exam earlier, you would understand that this was the pattern. Part A had 40% weightage. It was basically, when I'll talk in terms of general pediatrics alone. So 40% paper was general pediatrics and 60% paper was from super specialties or subspecialties. There were total of 6 subspecialties excluding pediatric neurology, and so you had about 10 questions coming from each of the specialties. So you had 40 questions coming from general pediatrics, 10 from neonate, 10 from pediatric gastro, 10 from pediatric onco, and so on. This is how the old preparation pattern was. Now, according to the new pattern, there will be total number of questions will be 150. They are to be attempted in 2.5 hours duration, and the paper will consist of questions from the general or basic components of the primary feeder broad specialty, or 50 questions will be at the level of postgraduate exit level. This is something you have already known. You know it about it already. What does it mean? First of all, you need to understand that there will be 150 questions to be solved in 150 minutes. So you have 1 minute approximately for each question to be solved. Now the weightage of questions, earlier what it was 40% general pediatrics, 60% specialties. Now that distinction has been done away with. By removing that distinction, what has happened is it has become a bit of ambiguous. We don't know what specialty is going to give what exact amount of weightage. But looking at what earlier used to happen in 2017, and by looking at what the actual paper is, we can safely assume that there will be a greater emphasis on questions being asked from general pediatrics. So if you're not very good in general pediatrics, nutrition, milestones, overlap changes, pulmonology, hematology, the core components, basics of these, you to face a lot of problem when it comes to correcting these specialties. Having said that, some of the students are sharing on some going to be, the weightage is going to be a bit different. How the weightage is going to be different, have a look in the next slide. Till 2020, the super specialties which were included, the club super specialties were 6. Now, pediatric neurology, as you can well see, it has now been included. Look at on the right side, look at point number 5. Pediatric neurology is now officially a part of the pediatrics paper. Unofficially, questions did used to come from neurology occasionally, but now you will have 7 specialties contributing to questions. So what you can safely assume is that approximately 50% or probably more than 50% paper will be related to your general pediatrics. The remaining part will be equally divided among these 7 subspecialties. So your weightage, your preparation time should be devoted according to this pattern itself, right? I'm getting some more questions and comments. I will be taking up all comments, answering all of them once this initial official part of presentation is over. Then I will take up live question and answer session. Now, moving further, what are the changes? To summarize, the division into part A and part B is no longer there. One full paper will be there of 150 questions in 2.5 hours. Questions will be asked from pediatrics, broad specialty at PG exit level. Now, all of you are either residents who will be completing your post-graduation, and many of you have already completed your MD. So if you remember, there are usually 4 papers of theory, and when it comes to your exit level paper, you are asked questions not only from specialties, but also from aptitude, that is the drugs, and some part of biostatistics as well. So when they specify that PG exit level will be used You can expect that there will be questions from drugs, there will be questions from, basics of, null hypothesis, different types of ordinal, Likert scale, biostatistics, the ones which you normally use in your thesis, etc. And majority of them, obviously 90-95% will be is going to be the pediatrics part. Questions will also be asked from subspecialties, though they have not totally been removed in pediatrics, and pediatric neurology officially has been added to the group. Right now, moving further, what are the changes which have happened with respect to eligibility? If you are MD Pediatrics and you want to sit for adult medicine super specialty, now you have to sit for the general medicine broad specialty paper also. What it means is, like, suppose I want to be a cardiologist, but I want to give it a try in pediatric cardiology also and in adult cardiology also. So what I will have to do is, first of all, I'll be applying and sitting for the pediatrics paper. The pediatrics paper weightage I have just told you, right? If you get a good enough rank, you are eligible to get pediatric cardiology DM seat wherever it is available. If you want to be an adult cardiologist, you will have to sit for the medicine group of paper, right? In medicine group of paper, you will have questions coming from all subspecialties of medicine. And because of that, you will have to, read about the medicine part as well. In one way, it has, leveled the field. Earlier, there was a lot of controversy that why pediatricians are also able to sit with some advantage in the adult medicine part as well. You are still allowed to sit, but you will have to prepare for that particular exam as well. So the aim basically was, when the draft probably was discussed, was specialty. In case he or she wants to shift, then you should be making some extra effort and learning about that specialty as well. And the rank and broad specialty group will make you choose your branch based upon whatever seats are available and whatever individual rank you get. Now, moving further, what are the frequently asked questions? Before you start, showering me with questions, I have made some standard questions which are based upon what all of you have asked me on Telegram, Facebook, and various forums. So, first of all, what will be the overall weightage of topics in the pediatric super specialty paper according to new pattern? First question. So, my answer might on this is we do not. But what we know for sure, 95 to 7% is based upon, it is going to be the applied aspect. So, you will have 1 or 2 questions being asked from embryology, development of cardiovascular system, development of hepatology. Already development of hepatology has been asked in NEET SS already 2 years back. So you will have questions coming from that. Then you will have for sure questions being asked from the commonly used drugs and their doses and their adverse effects. Vancomycin, which other drug can produce similar symptoms when given as bolus. So similar questions you need to be prepared for, but core is going to be pediatrics. In pediatrics, almost 50% be general pediatrics, but each specialty means is that you need not go into too many fine unnecessary details, like you need not go into the fine points of how you perform a EEG. Basics about EEG, understanding the basic patterns, identifying them, and hypsarrhythmia kisme, 4 to 6 hertz pattern kisme, that much is going to be good enough for you for your preparation. You don't need to go into the fine details of atypical EEGs. Thirdly, second question, will pediatric neurology question be asked in pediatric super specialty paper? Yes. Already 5 to 6 questions were being asked. Now you can safely assume that 7-8 questions will be of pure neurology will be there. So all those epilepsy, seizures, gray and white matter disorders you have to go through. Will Nelson be sufficient? The answer is yes. If you want to get a rank in the top 50 or top 100, Nelson will be sufficient. But if you want to get a seat of your choice and maybe get a single digit rank, then probably Nelson is not going to be sufficient. I'll be coming to it because Nelson contributes to almost 85 to 90% of your paper, 10 to 15%. If you look at any old paper also, it is still asked from the other specialties. So any special things I need to do, again, I'll be coming to it. I'll be discussing about it in the subsequent slides. Clinical or one-liner based. From what I feel is it is going to be a mix. Majority of questions, if you look at past papers, they are one-liner based, but last 2 papers, there has been some trend moving towards the clinical questions. So on an average, you can assume that from based upon the paper pattern, past papers I'm saying, I may be wrong also, but about 8 to 10 questions you can expect to be visual based. About 10 to 15 questions you can expect clinical based. About 15 to 20 fact based, dose of a drug, most common age, most common this, most common that, investigation of choice, those kind of questions. And the remaining are going to be, 2-liner or 3-liner based questions, or simple, the usual questions which you find. So it is going to be a mix. Do not try to practice variety of questions, but don't stick to only one variety. Be mentally prepared, because the pattern has just been changed. We know only as much as you people know, right? So what NB is going to do, we frankly don't know. The key is to be mentally prepared. The key is to be mentally prepared for your. The key is to be mentally prepared for whatever way the question is asked. Now, moving further, what are the changes in the app that we are going to do? Some of you have already subscribed for the app. You are subscribers. Some of you are, on borderline. Some of you are preparing for your own. So for those who have subscribed or wish to subscribe, I just want to share that these are important things. So based upon the new pattern, I had a talk with the management just today morning itself. Pediatric neurology videos will very soon, in the next couple of days, they will be made available in your super specialty pediatrics part. So don't worry on that aspect. Second part, in view of relative importance of general pediatrics, the videos and their material will be slightly readjusted. I'll be coming to that in the end. Mocks and question banks will also be modified according to new pack. So you can be rest assured about it. Overlap clinical scenario videos we are going to put up with general pediatrics with specialty videos. For overlap, things will be added for somebody who's who's just wants to try his luck, or just wants to sit for, be prepared for atypical questions. These are the things which are overlap things are going to be important for your AIMS, PGI and JIPMER exam as well. So something extra for those people also, small bit will be added. Special topics like drugs in pediatrics, basic one-liners in biostats, and basics of ventilation will be added. Basics of echocardiography, basics of nerve conduction velocity, which were originally planned and we had partially recorded also. Those things, the key point we will be adding to the existing video and removing the technical aspects, because the paper pattern has been changed accordingly. And all changes and the new videos which I'm talking about, they will be reflected in your schedule in your app within the next 2 weeks. So as per my official contract, I'm not going to talk about it, but as per what unofficial talk I had, over the next 7 to 10 days, everything will be compiled, recorded, and it takes about 5 to 7 days for everything to be available. So within the next 2 weeks, you will have everything in your hands. So you will have roughly 2 months to prepare according to the latest pattern, practice latest questions, and the extra things also. In addition, because we are done with 90% of the syllabus, 10% is still pending. All of you who are students and you wish me to specifically record a particular topic which you think has not been adequately covered, I don't think anybody else gives you the option for that. We will be looking into it, and if feasible, we will be adding it, even if needed, after the entire syllabus has been done. So that is, at least for my pediatric part, I can take full responsibility for that. For the general pediatrics part, I'm talking about. So these are the things that we are going to do from PrepLadder forum side. Moving forward, now we talk about from a student's perspective. Now this is you, the student, and me, the teacher, talking. What are the areas, sir, I should be focusing for the next 2 months? The areas you should be focusing is, first of all, knowing the enemy is equally important as fighting the enemy. So you need to understand the strengths and weaknesses of your enemy, that is your paper. If you look at the past papers, when I say past papers, I'm talking about 2018, 19, 20, as well as the whole papers from older years are not completely available, but based upon the questions which are available with us, 85% questions are from Nelson. 85% paper. That does not mean 85% people are able to get 85 out of 85 correct. Nelson is a huge book, and even if you have read everything, you all know that even if you read a particular chapter, one chapter of OP, still there will be some facts you will forget. So 85% question from Nelson means the bulk is going to be Nelson. That should be the final frontier Afterwards, you can go to other sources. The other sources are going to contribute about 15% of the questions if you look at the past papers. The other books which you need to discuss, this is also important for those second or first year residents who will be appearing in the next 2 years. So, padna sab hai, at the student life, read everything. But when it comes to super specialty preparation, additional books which contribute additional questions are Cloherty for neonatology, Lenskowski. It has not been updated, but whatever older version you can get hold of for hematology and oncology. Indian authors like Suraj Gupte, IAP or Ghai for malnutrition part. Personally, I favor Suraj Gupte for malnutrition, but again, it's a personal choice. Mew K Park for pediatric cardiology, a must, especially for pathophysiology part, and Fenichel for pediatric neurology, selected portions, not the entire book, not cover to cover. When you read Cloherty, please go through the congenital infection part meticulously. There were 2 questions in the last 4 years which were not there in Nelson from congenital infection, but were directly picked from Cloherty. So you need to, read these books slightly in details. Moving from past paper trends, NEET SS versus Central Institute Super Specialty Exam, what are the differences? This is again one area for students who have not prepared, who have not appeared in these papers. You need to have a perspective of it. In case of AIMS, PGI, JIPMER, and the other central institutes, you have tougher questions. You have lengthier paper and compared to NEET SS. That does not mean NEET SS is a walk in the park, but it simply means is the standard of questions is higher. The length of stem of questions in clinical questions is also higher. In these central institutes, more questions are asked from biostats, relatively, not absolutely, but relatively more questions from biostats, drugs, critical care, ventilation scenarios, and regimes in pediatric oncology. Like they will ask you, NEET SS people will ask you which drug is not included in BA regime. In super specialty of Central Institute, you may be asked questions from BA regime is useful, is maximally given for what duration, or which of the following malignancies it is not used. So slightly more details you will have to go in, slightly more. General pediatrics is still a rank decider in super specialty entrance exam. Even in these papers, although they are heavy on super specialty, still in pediatrics, general pediatrics is always the rank decider. And Nelson is still the important book, but reading other books, reading, AIMS protocols for neurology, reading the PGI Blue Book portions or the latest review articles published from pediatrics department of these institutes, they are additional things that you need. Moving further, what are the areas you should be focusing while preparing? If you look at the past papers, these are the areas from where questions are consistently asked, or I will always ask. Rheumatology and vasculitis. If you look at past, I'll take an example of 2018. In 2018 paper, there was one question on dose of methotrexate in JIA, one question on systemic onset JIA. There was 2 questions on Kawasaki disease, one on Henoch-Schönlein purpura, one question was asked on maternal heart block related scenario was asked related to SNE. So 6 questions out of 100 were from rheumatology and vasculitis. Similarly, pediatric hematology, especially your bone marrow failure syndromes, questions are very frequently asked. So please go through bone marrow failure syndromes, pancytopenias. I've tried to discuss in 2.5 hours, but that is a summary. There is no substitute, no teacher, no coaching institute is a substitute for your own practice, own preparation, own concept. So please do them. Severe acute malnutrition and micronutrient deficiencies are again a hot area. 5 to 6 questions every paper they are asked. See, agar dobara nahi aaya to don't blame me, but this is based upon the assessment over last 4 and 5 years, which myself as well as my team has done. So trisomies and aneuploidies, there will be questions. Chest X-ray, CT, MRI, images as well as one-liners are asked in cardiology and neurology respectively. Neonatal resuscitation, you know that guidelines are changing. What are the changes? They are important. PALS 2020 changes. Inflammatory bowel disease. Pediatric Crohn's disease, for some unknown reason, has become a trending topic for every institute examiner, be it Central Institute, be it others. So Crohn's disease, although we don't see it that frequently in children, but it is a hot topic for your entrance exam. So next 2 months, try to at least go through these topics from Nelson or from whatever standard book you are reading. And septic shock also, you need to go through it. Then pediatric infections, untouched area, COVID-19, tuberculosis changed guidelines, HIV drugs, viral rashes. These are and viral hemorrhagic fevers. These 5 areas you can expect significant number of questions to be asked in the paper. So go through these areas and you will be able to able to easily crack the exam. Now, finally, one opportunity. A lot of people said, "Sir, sir, it is so unfair. They are changing the pattern at this last moment." Try to find opportunity where others are panicking. One opportunity used wisely can change your life dramatically. Who knows, this change in pattern or this change, whatever has happened, might be good for you. Till you have actually sit in the exam, every candidate is equal. All it will come down to is how fine and how exhaustively you are able to revise and recall and recapitulate the paper. Now it's an open house discussion that I'll be taking, and I'll be taking up your comments, whatever, 5 to 10 minutes. So those who have missed or joined late, this video will again go up on the YouTube after this, so you can listen to this video again. Okay, irreplaceable. I'm नीचे से ऊपर जा रहा हूँ. So lectures, ECG lecture I just recorded today in this shirt itself. So when you see that lecture, immediately come to कि सर ने ये 9th September को record किया था. Stats lecture and community lectures were not originally a part of our plan, and so that will be uploaded in the end. Probably that will be coming after 16. So that will not be coming. That will record after the core pediatrics has been uploaded and available to you. So we'll have to take the help of the community medicine people as well for our allied specialties to give us the relevant stuff for you people. So lecture on cyanotic and acyanotic. There is 1.5 hours lecture of acyanotic. There is a 2-hour lecture on cyanotic. So both of them will be uploaded very soon. So you will be able to find it. Already recorded from my end. Please discuss about fibromas. Okay, Sahil, point taken. I'm writing on the side. Fibromas. I'll put up a brief summary. Please add lectures on biostats. I already told you, Anuj. Please share ways to raise doubts directly to you. One more, for people who have directly enrolled in the super specialty of PrepLadder, there is a Facebook closed premium group where you can send your request, join in, and myself is there. I've just joined myself today only, so I will be answering the queries there. For those of you who have not joined the institute, it is still absolutely fine. Learning should continue, and I will keep taking live sessions intermittently till your exams are over. I also have a discussion group for super specialty on Telegram. You can post your queries directly over there, irrespective of whether you are a member of any coaching institute or not, and I'll answer without any restriction. So you're most welcome, Aditi. Acid-base balance, Ronald, yes, it is one thing which is pending in the acid-base imbalance part. In the fluid electrolyte part, I will add it. You're welcome, Raminder. Hi, hello, Aditi. You're welcome, Neeraj. Janapriya Subumar. See, preparation tip for AIMS DM and PGI. More or less rules remain the same. AIMS entrance exam, whatever specialties become slightly more important, you need to go more into details. One-liners are not as easy as they are in NEET super specialty. Plus, you get good number of questions from dermatological part, pharmacological part of pediatrics. From biostats, you get good number of questions. Good does not mean 20 questions. Good means more than super NEET SS. You get more questions from critical care part. So critical care, even in neonatology part of AIMS and PGI, if you see, they ask questions based upon scenarios that a child was started on this, currently PIP itna, PEEP itna, and is acid-base balance picture they will give in, and then you have to decide whether you will increase the PEEP, decrease the PEEP, continue same ventilation, or you will need to change the FiO2. Such kind of scenario questions are asked. So your preparation level should be slightly on the higher side for these entrance exams of Central Institute. Waiting for other videos. As I said, for us internally, 15th September is our deadline for completing and recording everything. Whatever we have recorded so far, I'll sit with the team. We are currently editing, so 2-3 days it will take. And if you have bookmarked all videos, they will not be removed. We'll make sure. So we'll be combining, editing the videos according to the what we feel is the correct pattern. And pediatric ophthalmology, what all to read? Anmol Chaudhary, not much in pediatric ophthalmology. The key one-liners related to conjunctivitis, related to Goop thalamos, that is pediatric glaucoma. ROP screening has been discussed neurologist, neonatologist, so I will not be going into it. So the key parts are brief summary video of 45 minutes to 1 hour. I'll record in the end. So what all I have recorded and is not yet visible. I have already recorded the infections part. I've already recorded the cardiology part, majority of videos, and I've already recorded your general pediatrics critical care part that is being currently in editing part, and it will soon go up. Based upon what you people have said, fibromas, pediatric ophthalmology summary, and summary of biostat related things, we'll try to put it up as additional thing, no problem. And Karna Manusha, neurology videos will be the one which are recorded by Dr. Pratibha Singhi. So she was my professor when I was doing MD pediatric at PGI. So she knows best. She's the master. So listen to her. Her videos will be put up. Overlap videos, as I said, will be recording. Alag say separately once everything is done. That is a bonus thing, which we feel will be useful for those who are preparing for the Central Institute exam. So we don't want to leave out those people who are preparing for Central Institute. The entire course is structured for NEET SS, but something extra for those people also will be provided. Yes, endocrinology is pending. Precocious puberty, delayed puberty, hypothyroidism I've already discussed. That part is due to be uploaded. Complete thyroid I have discussed already. Growth hormone I also have discussed already. PIC-Cool 72, will they change FNP pattern also? Frankly, I don't know. Once it changes, obviously I'll come again and try to bore you again. So, Astha Dahiya, endocrine hyperthyroidism, adrenal insufficiency, pituitary diabetes. Yes, Astha, endocrine, I've just finished with the cardiology part recording. Endocrine part, I'll be starting from today evening itself. And I think in the next 2 or 3 days, they should be done. Thyroid pumps and PGA syndromes have just been recorded 2 days back. So it takes around 2 to 3 days for the team to edit and upload. So you will have those. Can you please release visual-based scenarios like ECG, MRI, histopath? But no, some things we are planning, but extra things will come after the way more than what we are. It is better ki once it is done and we are actually announcing, then it comes to you. Additional things we are planning some regular YouTube sessions for super specialty, including case scenario discussions where live discussion can be done. We are working on those things, so that will take some time. So you just need to wait for a few days more. Pga Pediatric Rheumatology, Ram Sundar, Pga Pediatric Rheumatology is one of the best in India. Professor Surjit Singh, he's currently HOD at PG also. He's the master of pediatric rheumatology, and it is the biggest pediatric rheumatology center in India, in Asia, I would say. If you want to go there, again, you'll have to read Rheumatology Inside Out. Nelson is a must. In addition, there is a book by Dr. Surjit Singh himself. It's an Indian author book. Chota sa patla sa book hai. Try to read, go through it. And in addition, also go through the nephrology part of Dr. Arvind Pga. There are 2 nephrology books by Dr. Arvind Pga. One is Protocols, and another is the proper pediatric nephrology part. So protocols are useful for quick revision, but if you have time, go through the proper wala, mota wala book. Nephrology, go through the glomerulonephritis, nephrotic syndrome, renal transplant part, especially if others you can't go through. How much time for revision, sir, one should keep? 10 days, 2 months and 5 days from now. Let us assume 5 days are miscellaneous. Keep them on the side. You have 40 to 45 days, you should be able to do 1 revision. In 10 to 15, in the remaining period, in the rest. All of you are pediatricians, please do not forget that. So NRP changes have happened. They are minor, very few. Changes in NRP is a I have recorded for the summary part of it. Since I am not taking up neonatology, so in PrepLadder SS I will not be discussing neonatology. But on YouTube channel for both NEET PG aspirants as well as super specialty aspirants, there is a combined small summary video which I have just recorded. In a day or two, it will be available, so you can go through it whenever you have time. Regarding pediatric critical care exam for AIIMS and PGI, anything extra to be read? Yes, for PGI critical care exam, basics of ventilation, ARDS ka management in details, HFOV ventilation, ECMO, their indication, their parts, when scenarios based upon those need to be done, either the IAP supplement for critical care or the pediatric critical care supplement by Dr. Sunit Singhi. Either of the two you need to at least go through once. Dr. Madhu Chandan M, yes, notes will be provided. More notes will be provided. There is a separate team which is currently working upon making the notes. So I'm not the competent person to comment upon it, but notes will be a part of the you'll be getting. Provide treasures in more details. Okay, pick pool 72, point taken. Treasures more. Then which book to be preferred for critical care questions? As I just said, for your critical care questions, I've just told you the theory part, you need to do something extra from either IAP manual for pediatric critical care or through textbook by Dr. Sunit Singhi. These are the two books I have read. So I know they're good and they are good enough. But in case you want to read any other book, that is also fine. Practicing the past papers is important. How to prepare for pediatric endocrinology at PGI? Pooja Singh, focus on growth hormone deficiencies, everything about it. Focus on diabetes mellitus. Focus on your thyroid part. I have done my thesis. My boss has been Vidya. He is currently the head of pediatric endocrinology at PGI, and sir is very fond of diabetes in children. He has done a lot of research in that. And when you sit for that exam, you can safely be assured that there will be a lot of questions being asked from latest changes, as well as the changes which are on the horizon. Any new drug, any new change, any new all those delivery devices for insulin which are currently being tried, case reports from PGI. In addition, if you are targeting the PGI DM pediatric endocrinology. Pediatric ventilation, Rudresh, the relevant part, according to what you need for NEET SS, I will be putting it up shortly. GIT, diarrhea and functional GI disorders, Astha, GI diarrhea, I have recorded already. It's with the team. They should be visible in the next few days. Whatever things are you find, you can directly which part has been done. You want me to take some certain topic in more details. It may not be possible to record the entire video, but relevant parts, what you need, summary part, in addition to what I have given in the video, I'm more than willing to share with all of you people. So I want this, at least the pediatrics SS part, to be a two-way thing. You ask me, I'll give you. End of the day, you should be satisfied, and more than that, you should be able to crack your exam. If you are not able to crack your exam, all this effort is waste on my part also, on your part also. So I'll try to keep all the open through Telegram, through Facebook also. I'm there on Insta, YouTube channel also. I'll be active on the Facebook group of PrepLadder. You can post all your queries related to pediatrics there. And whatever videos are being uploaded, I'll also keep updating. I'll try to talk to the team to keep updating it accordingly. And you're welcome, Astha. There are 2 or 3 MCQ books available in the market because of copyright things. Because the publishers are in conflict with the institute, so I'll not take the names, but there are 2 or 3 authors, 2 authors in fact. You can easily search through Amazon and try to order one of them. Disclaimer: many of the questions mentioned in those books are not exactly the way it has been asked. To give you an example, there was a question asked upon, there was a case, 4-line based case, in which they had talked about ascites, bilateral lymphedema and all those things in the patient. In recall paper, they just converted it into a 1-liner. The answer was correct, the topic was correct, but it was not the way it was asked. So rather than going into the details, you should be practicing paper from these guides or books which are available, but trying to know about the topic is more important than trying to just mugging up the answer to that question. Having said that, we are looking into the feasibility of super specialty solutions of ours as well. How much it will be feasible, I can't say, because 2 months is the only time which is left with us. But if you look at the videos which I am discussing, I am trying to tell you the and telling you what are the recent questions which have been asked. And there are few other things which we have planned, but it will be premature to tell them about it immediately. Before your exam, 1 month before your exam, you will be getting a lot other things additional to reinforce your video preparation. But right now, I will not comment upon it before it is officially on. Telegram group link, Astha, I will put up the link. Once this video goes up, I will put it up in the comment section. Love Bhagat, PQ seats included. Love Bhagat, I haven't gone into the details of the seats, so I'll not comment on what I don't know. Okay, Satish, I'll try live again in the next few days once my recording part is done. And right now I'm recording 7 hours a day, so I need to get some time also to make such updates and things like that. So those updates I will be putting. I will become more active after 15th or 16th. You're welcome, Sushil. It's not phenomenal. Phenomenal thing will be done by you. You will be the one who will do phenomenal things. I am retired. I am like Ravi Shastri. Not in all aspects, but in a way, I'm like Ravi Shastri. You people are Dhonis and Kohlis and Lord Shandul Thakurs and the female versions of these. So you are the ones who are going to rock. Can you suggest MCQ books for past papers? Saraswati, I've already talked about it. Can NEET PG questions be repeated? Yes, Pooja, NEET PG questions are indeed repeated. But at the same time, that does not mean you start going in too much into NEET PG thing. Brief summary, you have done a particular topic and you have a MCQ book of NEET PG, recent papers, pediatrics part. Just go through it quickly. Koi extra point mile, some topic you have left untouched, you can as a one-liner add to your own existing notes. But other than that, don't try to go too much into NEET PG. Few videos are still pending that might be uploaded. Satish, yes, I know there are few videos, not few videos. I would say the list which I saw, there are 12 videos which I have already recorded, but they are yet to be uploaded. They are actually, the team is combining them and editing them currently in view of the changes. So next 3 or 4 days, you will find 10-12 videos being uploaded, and a big rush of videos again will be uploaded around 15th or 16th. As I said, from my end, everything should be done in the next 7 to 10 days. Maximum 2 weeks, you should have all your videos of core pediatrics, what we promised, plus the additional things, except the biostats part and overlap part, everything should be available with you. And teaching is, Rudresh, you're welcome. Undergraduate, postgraduate, now super specialist. Pediatric conferences are now going to start. All of you crack your SS exams, move into super specialty. You come over and take some lecture. I love to meet all of you and listen to your sessions, sitting at the back, sipping upon a coffee. So think positive, not COVID positive, think positive. All of you know everything, whatever you have read, whatever you have seen, questions are going to be asked from them. But where do we go wrong? We go wrong in not being able to mark what we know. You might have remembered the value that you should be starting dopamine at the rate of 15 or 20. You must have started dopamine at the rate of 20 microgram per kg per minute. But when you go to the exam, you should be knowing that the dose for dopamine which is given is somewhere in the range of 5 to 9 microgram per kg per minute. 20 is on the higher side. Practically what we do is slightly different from what is written in the books. And that is one area where people tend to go wrong. So iron out the fine points which are there. And wherever in doubt, in what you do versus what is given in Nelson, go with Nelson, except neonatology part. In neonatology, go with whatever the faculty has taught you, because Nelson has a lot of ambiguities. Other than that, in all the other systems, Nelson, whatever it says, go with that, and you will always get your answer correct. Don't try to make a khichdi, don't try to spread things too much. One revision in the next 40 to 45 days, one quick revision in the last 15 to 20 days. For your last quick revision, we will bring out, we will create something for you in my individual and taking. I'm not talking about others. We will try to reinforce concepts for you people. So don't worry. And it's our first official meeting as SS faculty and SS aspirants. Just one of the few. We'll meet again and we'll talk about it again. So all the best. God bless everyone. And Astha is asking, do we read to Nelson after your notes too? You have covered most of the things in your notes. Yes, Astha. I try to cover Nelson as much as possible, but at the same time, self-reading, self-preparation needs to be done. Like in some areas, I have not gone into too much of details. For example, I recorded a topic on food allergy and food intolerance. So there is a 2-page table given on GI part of food allergies. What I have discussed in the video are the relevant 4. So ideally speaking, you should be reading that. But if you are short on time, those 4-5 bare minimum is option, right? This is in view of the 2 months time which you have. For those who are targeting the next NEET SS, you should be reading Nelson. Self-reading, self-preparation is the final frontier. Uska koi replacement nahi hai. HIV and TB guidelines. Yes, Ram Sundar. I'm working hard on it. In fact, I am reading the TB guidelines, the changes which have happened. I'll put it up. I'll put it up soon. That is pending. COVID, HIV, TB, तीनों का अलग-अलग 1 hour का video होगा, separate from pediatrics point of view. Ronald Ritchie, acid-base balance. I told you it is in the pending list which we have made. You're welcome, Pooja. Total number to be expected to give pediatric exam roughly in final. Nishu, it is very difficult to say. About these things, I think we'll discuss in the next session we have, right? Do we need to read as PGA, prep PGA, revision videos are there on this is thing possible in SS speeds? Not in my hands, but whatever comments you are posting, the bosses will also be looking into it. So let's see if we can work out. I can't, at my end, I can't talk about it. And Anmol Chaudhary, Asthma Gina Guidelines lecture, done, already done. It will appear in a few days. Already done from my end. 40-minute ka maine record kiya, I have kept it short. Only Gina Guidelines. No pathophysiology, nothing. And the therapy part. I have just discussed 2 aspects. Sir, is practicing with the PrepLadder Q bank enough? Neha, practicing with any Q bank is enough. At the, I don't want to sound like that, but practicing questions, if you have reasonable accuracy of the answers, I think that is good enough. Practice is more important. Source is immaterial. Whatever you read, practice. That's the key. Lastly, before I finish the session, there is for those who are not the members of PrepLadder yet, on 25th and 26th September, for 48 hours, you will have complete free access to all pediatric videos available. Right? So those who want to just see the videos or go through those critical points or topics which you have not gone through, you can go in those 48 hours. So there will be completely free access. You need to download the app, create a free account. Details will be shared with you by the technical team. And 25th and 26th September for pediatrics, different days for different subjects. 25th and 26th, pediatric super specialty. All videos will be available free of cost to see, and all your relevant notes and additional things which we have put, everything will be accessible for those 48 hours. So you can have a look and add that, zing to your preparation. So pneumonia, Karanam Anusha, pneumonia I've done already. Pneumonia I've done, diarrhea I've done, GINA guidelines I've done. Cardiology, half part of the individual diseases I've already done. They are in processing right now. They take some time. In between I'm coughing, in between I'm scratching myself. So those things have to be edited out. The lighting has to be adjusted, voice has to be adjusted. So those things take time. Those will be done and those will be available in the next coming few days. Okay. And can you post the important topics to focus on for all systems and update note? Yes, I'll do that. I'll do that. Not immediately, but give me a few days. I'll do that on all these forums possible. Right? So it was lovely, all of you. Yes, Nishu, updated tests are being planned by the team. They are already being planned. I've just been told. So all of you prepare hard, do well, and few months later we meet again. You as super specialist, higher placed than me, and we'll run into each other someday, and we'll have share a cup of coffee together. And you'll say, sir, उस दिन वो lecture सुना था, और ये आपका वो video था, वो point वहाँ आया. That is the thing I want to hear, which help you get through. So that is what keeps me motivated, and you should look for your motivation yourself. यहाँ तक आए हैं, you have reached till now. Why give it at this last moment? Go the entire stretch and be the super specialist that you want. It will all be worth it. Trust me, it will all be worth it. All the best. Bye. Okay.
End कर दिया।
And